This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about how to tell if you broke your ankle. So I'll first say that the ankle is kind of shaped like this. It's called a mortise joint, where the top foot bone, called the talus, kind of sits in the middle, and there's these two ankle bones on the inside and outside of the fibula and the tibia, and that kind of makes the ankle joint. And you can actually feel them on yourself, the bumps on the inside or the outside. So normally when people say they broke their ankle, it's because you broke kind of the bone on the inside or the outside. Sometimes you can break the top of your ankle. That's called a tibial plafond fracture. That's a little bit different. But by and large, when most people say they broke their ankle, they broke either this inside bone or this outside bone. So how do you know? Well, if you break it bad enough, your foot will actually dislocate out, and it'll be very obvious that you broke your ankle because it'll look totally deformed and swollen, and it'll bother it. You'll have to get immediate medical care. But there's times where you break it where that doesn't quite happen. The ankle doesn't quite dislocate, and one of these two bones are broken. So you'll know if your ankle is broken if you see a lot of bruising and swelling. Whenever a bone breaks, it releases a ton of blood, and that goes into the skin, so there'll be a lot of bruising. And that blood will you kind of flow down, so it may even go down into the foot, as you know, with gravity. It'll hurt a lot to stand on it, and you might find that you can't really put any pressure on it at all without significant pain. And you may find that the pain is either on the inside or outside the ankle, or on both, because you can break both. So sometimes, depending on how bad you broke these, if you break both the inside and outside, you pretty much always need surgery. If you break the outside, but this kind of shape, this mortise shape, stays intact, usually you don't need surgery. Again, you'll have pain on the outside. Or if you break the inside, but this shape stays intact, then you also don't need surgery, and you can get away with basically a big old cam boot, which stands for controlled ankle movement. You've probably seen them. You can get them on Amazon, these big boots. And weight bearing, non-weight bearing, or partial weight bearing, or weight bearing is tolerated. So the best way to tell, honestly, is if you have a lot of ankle pain and you did something to it and you can't walk on it and you think you might have broken it, you can get x-rays, and that'll pretty much tell you almost 100% of the time whether you broke your ankle or not. If you're able to walk on it, maybe it's a sprain. It doesn't hurt too bad. If it gets better over the next few days, usually breaks don't get better over the course of a few days. So if it is, then it might just be a sprain or soft tissue injury. But the most definitive way to tell is just to get an x-ray, and that'll tell you. So I hope I was able to answer your questions about how to tell if you broke your ankle. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond, but note that I can't give you medical advice about your specific situation. If you like this video, we put out new content every week, so please like and subscribe, and thanks for watching.